Hi, I'm Dr. Jeremy Heyman, naturopathic doctor here at Cornerstone Naturopathic, and as promised, I'm continuing my weekly discussion on anti-cancer foods. Today we're talking about ginger, and by far, ginger falls in the category as a priority food, a priority superfood in terms of its anti-cancer capabilities. So for those that have consumed ginger or currently consume ginger, you're well on your way to significantly reducing your risk of a variety of cancers. And those that don't currently consume ginger, then it's something that, once you finish watching this video, um, leave your home, go to the supermarket, go to the health food store, and make sure you're picking up some ginger. Now, when I'm talking about ginger today, we're talking specifically on the ginger root. There are different aspects of ginger. There are ginger leaves as well. There's fresh ginger, there's dried ginger, there's ginger extracts and so on, like ginger tea and tinctures of ginger. What I'm talking about today is for you to go to the supermarket. Most grocery stores and health food stores carry it, and go to the produce section and pick yourself up some ginger root, fresh ginger root. And what has the science shown? So the science has shown that, as like many of these other plant-based natural anti-cancer foods, ginger also contains an abundance of polyphenols and phenolics, which fall under the category of phytochemicals. And like I've said in my previous videos, there are thousands and thousands of phytochemicals that have already been identified as having anti-cancer capabilities, which is why I always promote a large proportion of what you're consuming to be plant-based, because these foods are available to us in the plant world, and the plant-based foods are the ones that are really showing to prove as anti-cancer beneficial and provide that anti-cancer activity. And this can be in combination with, if you consume meat, if you consume different types of food categories, that's fine. I'm not telling anybody that they need to be vegetarian or need to be vegan. But what I am saying is, based on your current diet, ginger is certainly one of those super powerful anti-cancer foods that absolutely needs to be included in your day-to-day diet. When I say day-to-day, I mean every single day. So I'll talk to you in a minute about how we consume ginger root on a regular basis. But for now, let's talk a little bit about ginger itself. So the oils in ginger themselves are typically responsible for that distinct aroma that comes with ginger. Everyone knows the scent of ginger, most people should. And there are pungent compounds in ginger that are responsible for the spicy sensation that you get when you actually chew ginger or consume any type of ginger in any form. But like I said, we're talking about fresh ginger. If you're consuming dried ginger as like a dry leaf tea, or in any other dry ginger method, it still does provide the anti-cancer property. There are just different constituents that are at play in a dried form versus a fresh form. But either is great, but I always promote the fresh ginger root. As far as its roles in anti-cancer pathways, we have a pathway called NF-kappa beta pathway, and the NF-kappa beta pathway, without getting too scientific, is involved in promotion of inflammation. So it's a major mediator of inflammation and the presence and promotion of inflammation in cancer. So the more inflammation we have in the body, the more inflammation that's introduced, the more potential for cancer to develop and grow. And once it has developed and grown, further inflammation allows it to promote it to grow even further. So NF-kappa beta, what we want to do, and what ginger and the gingerols, which is one of the constituents in ginger, has shown, is that it actually reduces and blocks this NF-kappa beta pathway. And I'm bringing up this pathway because this is actually like a major pathway in science and a major pathway in conventional medicine that these chemotherapeutics are actually trying to target. So whether it's integrative medicine, conventional medicine, alternative medicine, NF-kappa beta is a major pathway that all these pharmaceutical drugs and natural medicines are working effortlessly to try and reduce and block. And if we're able to do that, then that's a major pathway out of the way in terms of cancer initiation, promotion, and growth. So with NF-kappa beta as well, if we have long-term inflammation, that will also suppress the immune system. So when we have an immunosuppressed situation, those immune cells that are able to survey the body and the blood for cancer cells are less able to do that. So we want to make sure that we're taking inflammation out of the way. And some people know they have inflammation. So people have sore joints, sore knees, sore neck, sore back, that kind of thing, or they're overcoming an injury, so there's inflammation present. The more dangerous situation is when we have what's called a low-grade inflammatory state. So blood tests may not show it, physical symptoms may not show it, but based on history and based on some insight there that we can look at, we can determine whether there is a low-grade inflammation. And if that's the case, naturopathic doctors, specifically naturopathic integrative doctors that focus on cancer care and cancer support, are very knowledgeable at being able to get in there and intervene and reduce that chronic inflammation and hopefully eliminate it. And that in itself is a major area where we're able to remove that risk factor for cancer, and thus your risk factor for cancer of many cancer, if not every cancer, actually gets reduced even more. So overall, study-wise, in the science, literature has shown that ginger is extremely cytotoxic. So cytotoxic means that these constituents in ginger are able to identify cancer cells. They go in and they directly destroy cancer cells. So the other beneficial thing with ginger, which many of these other anti-cancer foods are able to do as well, is they're able to take the secondary and tertiary pathways and interrupt them. So that means basically, like for example, cancer cells need a formidable blood supply to be able to maintain themselves and grow and metastasize and become more aggressive. And ginger is able to actually reduce and cut down that what's called angiogenic pathway. So it's able to take the blood supply, the vessels, cut them off, so that these cancers can actually provide or bring in nutrients and bring in nutrition to be able to survive. So that's another major pathway that ginger works at. And it's a major pathway that even chemotherapies and a lot of the conventional therapies are just sort of starting to work towards. So not necessarily how our chemotherapy is able to directly kill cancer cells, because cancer cells can be killed, but typically what happens is those cancer cells are just replaced with more cancer cells. So we're looking at like stem cell focused targeted therapies, both in integrative medicine, which is able to in some circumstances focus on those stem cells, and the supportive pathways. So not directly just the cancer cell itself, but the tumor, the microenvironment. So the environment surrounding the cancer cell, and taking away those supports so that a cancer cell can't continue to grow or survive at all. So anti-angiogenic, apoptotic, which basically just programs a cancer cell to basically commit its own self-suicide or to die, and other pathways that block or deactivate cancer promotion. So ginger as well, there's lots of discussion on anti-nausea benefits. So is definitely safe with certain chemotherapeutics and after certain chemotherapeutics in terms of like stomach upset and nausea. And I always tell people, always consume organic. Always consume organic ginger. And the ways that we're going to consume organic ginger, if you're getting the whole ginger root, you're cutting a thumbnail size off every day, throw it in your shake. A great way to do it is to take a 2 or 3 thumbnail size ginger root and juice it, because then you're getting the juice and much of the constituent and the anti-cancer benefit. Drink it as a tea. You can saute it, you can chop it up and throw it in your stir fries any way you want. Put it in your eggs if you eat eggs. However you want to spice up your food, but ginger by far, get out, go get some ginger and make it worth your while and reduce your short and long-term risk of cancer, and eat your ginger every single day. Thanks very much, and we'll talk to you again next week with our next anti-cancer food.